about 3 in 4 adults have at least one chronic disease, and more than half of adults have 2 or more chronic diseases. Many of these chronic diseases are diet related, and chronic diseases are conditions that are lasting more than 1 year with symptoms that impact activities of daily living. Many of the leading diet-related chronic conditions in the United States are cardiovascular disease, type 2 diabetes, certain cancers, obesity, hypertension. And all of these, again, are diet related. And obviously there's other factors at play here, but many of the times diet is a modifiable risk factor tied to many of these chronic health conditions. And poor diet is also a major risk factor for premature death. But the great thing is that we know diet is a modifiable risk factor. Dietary patterns can be changed, unlike things that are kind of out of our control, like family history and genetics. But when we look at research, especially a lot of research from the Nurses' Health Study, improvements in diet and people who follow healthier diet patterns oftentimes are going to have anywhere from a 14 to 21% lower risk and decreased risk of cardiovascular disease. We see that individuals who follow healthier eating patterns have anywhere from about a 33% lower risk of type 2 diabetes. And we see that 18 to 26% of people who follow, or individuals who are following these healthier eating patterns, have reduced all-cause mortality. And I know I keep saying healthy eating patterns, healthy diet, and many of these studies are utilizing dietary guidelines and patterns, whether they be U.S. dietary guidelines or if we're looking at other evidence-based dietary patterns like the Mediterranean diet or the DASH diet. These types of diets are what are, helping to decrease the risk of many of these chronic diseases. So even some modest improvements in diet quality can really yield some really significant measurable outcomes and decreases in these chronic conditions. So hence why we have, these dietary guidelines